At the Emory Bariatric Center, we offer 3 surgical options to our patients. One of them is called a gastric bypass.
The gastric bypass operation is really the standard bearer, or I tell people the Mercedes-Benz of weight loss operations. What it does is it creates a very small pouch with your existing stomach, and I tell people it's really the size of your thumb. That is your new stomach. With that, it restricts the amount of food that you take. We also rearrange your intestines so that this pouch empties directly into the intestines, and that induces malabsorption. So maybe more than 50% of what you're taking is not going to be absorbed.
Another surgical procedure is called the laparoscopic sleeve gastrectomy.
What we do in the sleeve gastrectomy is that essentially we remove the reservoir portion of the stomach and create a gastric tube, a very thin tube, which really works by restricting what you can eat.
A third option is to use a technique called gastric banding.
We place this band at the area where the stomach connects with the esophagus, and the purpose of doing that is to progressively create a pouch. You can see this little bulge here that's via restriction. So as this band is inflated, the pouch that the patient effectively feels is their stomach is made to be smaller and smaller. They won't eat as much as they normally used to eat because they feel restriction. And when they feel restriction, they know it's time for me to stop.
All 3 surgical options at the Emory Bariatric Center are performed laparoscopically. That means much quicker recovery times for patients.
Laparoscopic surgery allows us to do the operations with keyholes, 5 to 7 keyholes on the abdomen, and the patients can go home within 36 hours after major operations.
For more information about surgical procedures and other options offered at the Emory Bariatric Center, call the Emory Health Connection at 404-778-7777 or register for one of our free bariatric surgery seminars.